In this exercise, I'm going to be demonstrating the dead bug, and the dead bug is a core exercise to increase the strength and the firing of the deep abdominal musculature and spine stabilizing muscles. So we find this very underactive in a lot of our patients, especially our athletic patients. They develop a bit of an athlete's back or an anterior tilt through their lumbopelvic region, meaning that they have really tight hip flexors and have dominant hip flexors that they're using to try to stabilize their back versus their big core muscles. So we want to try to reverse that a little bit, take the reliance off of the hip flexors, get the spine and the deep core muscles more involved, which will help ultimately with their performance because they'll be more stable through the lumbopelvis, and then their quads, their glutes, their hamstrings will be able to participate more effectively in their movement patterns for their sport. So what this exercise looks like, lay flat on your back like so, and you're going to bring both legs up, both arms up. Now, before I demonstrate the motion, in our lower backs, we have normal curvature, so you're gonna feel a little bit of space underneath the lower back here. But in an athlete's back or someone who has an anterior tilt, that's gonna be really accentuated, and they've lost the ability to be able to contract those muscles and keep a more neutral spine. So what I'll tell those patients is, before they get into the exercise, is press their lower back towards the ground into their fingers here. So you press in, and you should feel some pressure of the muscles into the fingertips if you're doing it correctly. Now you want to hold that, bring both legs up, and then what you want to do here is keep that tension into your fingertips, lower one leg till you're about a foot off the ground, and then bring it all the way back, and then you're going to alternate. Now starting off, it's okay to keep your fingertips there. It's a bit of a reminder to keep your back pressed down towards the ground and keep that area engaged. As you get more accustomed to it, then put your hands up over the shoulders and maintain that position in your lower back. So this exercise becomes more challenging the further your leg gets away from your center of gravity, and your back is going to want to lift up off the ground, and you want to resist that. That's the part of the exercise that's most important. That going back to the athlete's back or the anterior tilt through the pelvis, that they're going to have a really hard time holding their back down because they're going to be engaging their hip flexors more. So we have to reverse that, keep that back pressed towards the ground as they're lowering the legs. Okay, so you want to shoot for about 3 sets of 10 of those. If straightening the leg out is a little too difficult to start off, then what you want to do is, instead of doing the full leg straight, just keep the knee bent, move down until your foot touches the ground, bring it back up, alternate to the other side. Just like that. And then as you get more and more developed with this exercise, there's very many different techniques that you can do to make it more challenging, where you can use medicine balls, you can use Swiss balls to do some co-contracting while the other arm and leg lower. There's many variations to this exercise, and working with a sports chiropractor or a personal trainer who can take you through those variations as you get stronger, that's what you want to do. This exercise should always be a challenge for you, and it will really increase your lumbopelvic stability.